Hello, dear ANA community. What do you mean by diagnosis? How to identify or how to make the diagnosis based on the given clinical scenario? What actually clinical scenario refers to? What are the points or factors to be analyzed while taking the consideration of clinical scenario? We are going to discuss in this particular video. Dear community members, put a thumbs up on this particular video and spread this particular video to the maximum number of true Nidana learners so that we can make a huge movement out of this particular message. So that when you make the uh, like button as such, so that will be giving the YouTube the algorithms, right algorithm, so that the right video will be reaching to you at the right time for the right knowledge as such. That's why put a like and a thumbs up and spread this particular to maximum number of true Nidana learners. Now, coming to the clinical scenario. The clinical scenario goes like this. 38-year-old female patient presented to you with the pain in the epigastric region since 2 days. This is the clinical scenario. When you think about this, what is the system that comes to your mind? Naturally, it is the alimentary canal system as such that will be afflicted in this particular situation. And when you think about the Srotas affliction, there are three possibilities. There may be a possibility of Pranava Srotas affliction, there may be a possibility of Annava Srotas affliction, there may be a possibility of Purishava Srotas affliction. So that means when you think about the Srotas, it is whole Mahasrotas may be afflicted. Suppose if the person is having the pain in the epigastric region associated with vomiting, then we may suspect Annavasrotas and Pranavasrotas affliction. Suppose if the person is having the pain in the epigastric region, not associated with vomiting, but it is associated with diarrhea, then we may suspect Annavasrotas and Purishavasrotas affliction. Now, when you think about the clinical scenario, the dosha affliction here that could be pitta dosha vitiation as such. Now we are looking into some additional informations. So the additional information that 38-year-old lady, she consumed gobi Manchurian, which was considered 40% of the proportion of the total food consumed on the previous day. That means on the 3 days back, she has consumed gobi Manchurian, which was considered to be having the more amount of the spicy, more salty, and more sour taste as such. So that means, so that will be having the katu, amla, and lavana rasa as such. So that means which is having the tejo mahamata dominance. So that is associated with ushnavirya and katu and amla vipaka there. So when you think about the overall case scenario, so the Nidana was considered to be Pitta dosha vitiating ones. And when you think about the overall external features as such, she was a Pitta Prakriti lady based on the physical parameters. And when you think about the development of the pain that was observed at midnight at around 12:30 a.m., this was associated with vomiting, whereas the vitals, that is the pulse rate, temperature, blood pressure, etc., they were respiratory rate, they were within normal limits. And on examination, tenderness was observed in the epigastric region as such. For abdominal examination, that was associated with tenderness in the epigastric region. So when you think about these additional informations, which particular source affliction we may suspect that? Naturally, it is not the Purishava Srotas in this particular situation. Annavaha Srotas and Pranava Srotas was being afflicted in this particular situation. The reason is the lady was getting the pain in the epigastric region associated with vomiting, not the diarrhea. That's how. So the this Srotas affliction were being considered. Now, regarding the further decoding of this case scenario, when you think about the dosha vitiated as such, it was considered to be pitta. Whereas when you think about Sannikrishna Hetu as such, the age of the lady was 38. That is coming under the natural pitta dosha dominant age group, that is 30 to 60 years as such. And when you think about the dominance of the symptom, it was worsened at around 12:30 midnight. Again, it is considered to be the pitta dosha dominating season itself. And when you think about the Bhakya Hetu, gobi Manchurian consumption, 40% of the food was total food consumed was having the gobi Manchurian. So that means which is having the Katu, Amla and Lavana Rasa, Ushnavirya, Amla and Katu Vipaka. All these are considered to be responsible for the increase of the Pitta dosha in the body. And when you think about this Annava Srota affliction here, initially it was the Annava Srota affliction, then it was observed Pranava Srota affliction as such, because the lady was having the pain abdomen and vomiting. But if the lady had pain abdomen and diarrhea, then there could have been the affliction of Srotas, could have been Annava Srotas and Purishava Srotas. But it is not the case in this particular situation. It is Annava Srotas and Pranava Srotas affliction. Then, as far as Srota Dushti observed in this particular situation was Sangha. Because she had the pain, probably there may be a possibility of Sangha at that particular Annava Srotas, particularly in the Amashaya. But the Vimarga Gamana was being noticed, that is Prati Marga Gamana, that is in the reverse movement. She had the vomiting as such. So that means we may suspect Vimarga Gamana was happening in Pranavaha Srotas as such. As far as Udbhavasthana is concerned, it is initiated in the Amashaya. So that is the Adho Amashaya, what we may say, and Urdhva Amashaya, that is Pitta and Kapha dominance as such. As far as Sancharasthana is concerned, Mahasrotas, the two upper half of the Mahasrotas as such. Lower half was not being affected at this particular juncture because she was not having the diarrhea as such. She was not having the disturbed, what do you say, that the Apanavata function as such. As far as Vyaktasthana is concerned, Uras and Vaktra were being observed here because she was having the pain in the abdomen and she had the vomiting. So that is Uras and Vaktra can be considered. As far as Roga Marga afflicted in this particular situation could be Abhyantara Roga Marga. So when you look into the decoding of this particular scenario, what is the rationale behind it? What is the utility there? So whenever if you think about it, it is the Pitta dosha vitiation is being seen. That means we have to give the treatment for Pitta dosha shamana. So that is being mentioned in Ashtanga Hridaya. Pittasya sarpishah pana swadashiter virechanam swadatikta kashayani bhojanani aushadhani cha sugandhishita hridyanam gandhanam upasevana kanthe gunana harana manina marasadri karpura chandanoshiri anulepakshane chane pradoshashchandrama sudam harigitam himonilaha, etc. As far as Nidana Parivarjana is concerned, Nidana Parivarjana of Pitta Prakopa should be done. Katvam Loshna Vidahi Tikshna Lavana Krodho Pavasa Tapastri Sanparkati Latasi Dadisura Shiktarana Ladivi Tejirite Bhojanecha Shraddhi Krishna Siti Praninam Madhyane Tatha Ardharatrasam Vittam Prakopam Rajet. These are considered to Pitta Prakopaka Karana. For that, you have to plan in such a way that the Nidana Parivarjana should be done of Pitta Dosha Prakopa. And whenever if you think about the Srotu Dushti Chikitsa, we have to plan Annava Srotu Dushti Chikitsa as well as Pranava Srotu Dushti Chikitsa has to be planned simultaneously. And as far as Roga Marga affliction was concerned, it was Abhyantara Roga Marga affliction was being seen. So that means the pathogens or vitiated dosha are present in the Mahasrotas itself. So that means the Pratimarga Harana, that is, or what we can say, Asanna Marga Harana is very, very easy in this particular situation. As the person is having the Urdhvagati of the dosha, then it is ideal so that we can eliminate it via Vamana, or what we can say, Ullekana line of treatment can be planned in this particular situation. In this way, you can make the decoding of the patient situation based on the given clinical scenario. Now, what are the call to action? What you have to do in the coming days while taking the cases as such? First and foremost thing, identify the lakshana first. Which is the lakshana a person is presenting with? Is it pain abdomen, or is it chest pain, or is it cough, or is it the loose stools, or the burning micturition, or is it joint pain, or is it numbness in the hands, or the burning sensation in the soul, etc., etc. Identify the lakshana first, and try to identify the duration of that particular lakshana. How many days the person is having this particular lakshana, and based on that, try to identify the nidana, which is nearer to that particular lakshana itself. What, for example, if the person is having the presenting complaint in 3 days, what particular change in his diet and lifestyle has been done during those 3 days? That has to be noted, and that has to be linked in terms of nidana as such. What part nidana as such has been done, nidana sevana was being done, and based on that, you have to know about the what is the dosha of vitiation was being seen in that particular situation, which particular dosha affliction was being seen. That is, whether which particular dhatu is being afflicted, which particular mala is being affected, that has to be known. Which is the srotas involvement was being observed in this particular situation has to be planned. And based on that, which is the srotas which happened inside the body has to be known. And this later, you have to correct the additional information as much as possible in terms of the patient's personal data, in terms of the patient's the other occupation or residence related details, etc., etc., and connect them to the lakshana and other factors, and try to make the diagnosis based on the above said parameters, and try to make the rationality for your diagnosis and management plan, so that the proper communication can be done with the self, and proper communication done with the Ayurveda fraternity, and proper communication can be done with the Ayurveda health seekers. That can be done with very, very easiness. Here in a community, that's all for today. What are the major key takeaways from today's discussion mentioned in the comment box below? And what is the one video that I'd like to hear in the coming days in this particular channel mentioned in the comment box below? And spread this particular video to maximum number of true Nidana learners, so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.